Insulin, insulin, insulin. Ever wondered how it helps millions of people manage diabetes? In this video, we will dive into the world of insulin therapy. But first, let's understand what insulin is and why we need it. When food is broken down in the digestive tract, it is broken down into its component nutrients, where it is absorbed into the bloodstream. Glucose, a simple sugar, is one such nutrient. Glucose enters the bloodstream and moves into the cell. This process causes blood glucose levels to rise, which will then, in turn, lead the pancreatic beta cells to secrete insulin into circulation throughout the body. Insulin is a necessary component for glucose to reach and be used by several important target tissues throughout the body. This distribution of insulin will also keep blood glucose levels within stable limits. While the main use of insulin is the treatment of diabetes mellitus, insulin is also used in the management of gestational diabetes, diabetic complications like diabetic ketoacidosis, hyperglycemic hyperosmolar non-ketotic coma, and our hyperkalemia or high potassium. Now let's discuss diabetes mellitus, or DM, a metabolic disease involving inappropriately elevated blood glucose levels and the body's inability to utilize its insulin properly. There are two main types of diabetes mellitus. Type 1, which occurs when the pancreas cannot produce insulin in order to maintain a normal glucose level. Insulin therapy is lifelong. Type 1 always needs insulin. And then there is Type 2, also known as insulin resistance, is where the bodies have enough insulin, however unable to respond to that insulin. This means that the glucose cannot reach the target tissues. Both types of DM lead to the same problem, still starving for energy while glucose builds up in the blood. This is known as hyperglycemia. Insulin is categorized by the onset of action and duration of the effect. Here we will discuss 4 categories of insulin. Number 1 is our rapid acting. This includes aspart, lispro, and glucosamine. The onset is 15 to 30 minutes following administration, and it peaks at 30 minutes to 3 hours, and it can last from all the way to 3 to 5 hours. Then we move on to our short acting, or this is our regular insulin. The onset of 30 minutes to 1 hour following administration peaks at 1 to 5 hours and a duration of 6 to 10 hours. It must be noted that regular insulin is the only insulin that can be given IV or intravenously. And then we have number 3, our intermediate acting, neutral protamine H-dorn, or NPH insulin. The onset of 1 to 2 hours following administration peaks at 4 to 14 hours and lasts 14 to 24 hours. And then we have our long-acting, which is insulin glargine. An onset of 1 to 4 hours following administration. It does not have a peak, and it can last all the way to 24 hours. Our long-acting should not ever be mixed with other insulins. And all these categories of insulin should be administered using a pen or syringe subcutaneously, while our rapid-acting insulin could also be given through a pump. One of the most commonly used insulin regimens is known as basal bolus, in which the basal insulin, slower reacting kind, like intermediate or long-acting, is given before bed in order to maintain a fasting blood glucose levels. In addition, a bolus of a rapid or short-acting insulin is given before meals to control postprandial glucose levels. This approach usually means 4 to 5 separate shots daily, 3 injections of bolus insulin, as well as 1 or 2 injections of basal insulin. For a simple regimen with fewer shots per day, intermediate-acting insulin can be pre-mixed with rapid-acting or regular insulin in 1 syringe or pen. This combination is typically taken only 2 times a day before breakfast and before dinner. Keep in mind that there are side effects to watch. The most common side effects are hypoglycemia due to excessive insulin administration, lipodystrophy from repeated injections at the same site, and these can present as skin depressions or atrophy, or a raised skin bump, hypertrophy. You can also have possible anaphylactic reactions. It is contraindicated in patients that are hypoglycemic. Higher risk groups that you should watch with insulin are your elderly, or sick patients with persistent vomiting or diarrhea, and clients with hepatic disease and renal disease. If you use insulin, remember, watch for symptoms like dizziness, sweating, and confusion. This is a good sign of hypoglycemia. You should also rotate your injection sites to prevent skin changes or lipodystrophy like we talked about. Don't forget to store unopened vials in the fridge. Keep current vial at room temperature.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information.